Doctor, I'm really worried. I don't know what's happening to me. I've been feeling absolutely awful these past few days. Constant headaches that just won't go away, fever that spikes at random times, and muscle aches that make it hard to move. And to make matters worse, I just read something about Marburg disease. It sounds absolutely terrifying, like something out of a horror movie. Dr. Jones, a picture of calm and composure, nodded reassuringly, his demeanor a stark contrast to John's anxiety. John, it's completely understandable to be concerned after reading about something as serious as Marburg disease. But let's take a step back and talk more about what you're experiencing. Can you describe your symptoms in more detail? John went on to describe his symptoms in greater detail, mentioning not only the headaches, fever, and muscle aches, but also a growing sense of fatigue that left him feeling drained all the time, a loss of appetite that made eating a chore, and a nagging pain in his stomach that seemed to come and go without any clear reason. He had recently returned from a trip to Africa, which he knew increased his risk of contracting various diseases, including Marburg. I appreciate you sharing your concerns, John. It's important to talk about these things so we can address them properly. Let's talk about Marburg disease in more detail so you can understand it better. Marburg is a rare but severe hemorrhagic fever that affects both humans and non-human primates. It's caused by the Marburg virus, which is in the same family as the Ebola virus. The disease was first recognized in 1967, when outbreaks occurred simultaneously in laboratories in Marburg and Frankfurt in Germany, and in Belgrade, Serbia. The people who were infected had been exposed to imported African green monkeys or their tissues while conducting research. The symptoms of Marburg disease can be quite severe and typically include sudden onset of fever, chills, headache, and muscle pain. Around the 5th day after the onset of symptoms, a rash, most prominent on the chest, back, and stomach may occur. Nausea, vomiting, chest pain, a sore throat, abdominal pain, and diarrhea may follow. Symptoms become increasingly severe and can include jaundice, inflammation of the pancreas, severe weight loss, delirium, shock, liver failure, massive hemorrhaging, and multi-organ dysfunction. It's important to note that Marburg disease is not easily transmitted. It spreads through direct contact with the blood, secretions, organs, or other bodily fluids of infected people, and with surfaces and materials contaminated with these fluids. The risk of transmission can be significantly reduced by taking proper precautions, such as wearing protective clothing and practicing good hygiene. So, while it's good to be aware and cautious, there's no need to panic. We'll run some tests to rule out Marburg and other possible causes of your symptoms. In the meantime, try to stay calm and take care of yourself. We'll get to the bottom of this together. John felt a wave of relief wash over him. He knew he was in good hands and that Dr. Jones would do everything possible to help him. With a plan in place and a better understanding of his symptoms, John left the doctor's office feeling more hopeful and less anxious about the days ahead. Marburg virus disease is indeed a serious illness, known for its high fatality rates and severe symptoms. It can cause hemorrhagic fever, which leads to bleeding, organ failure, and often death. But it's important to remember that it's relatively rare. Outbreaks are infrequent and usually occur in isolated regions, making widespread transmission less common. He explained that Marburg is caused by a virus similar to the one that causes Ebola. Both viruses belong to the Filoviridae family and share many characteristics, including their mode of transmission and the severe impact they have on the human body. It's primarily found in certain species of fruit bats, which are considered the natural reservoir of the virus. These bats can carry the virus without showing any symptoms, making it difficult to detect and control in wildlife populations. But it can spread to humans and other animals. This usually happens when people come into contact with the bats or their excretions, such as urine or feces, which can contain the virus. The initial transmission to humans usually occurs through contact with infected animals. This can happen during hunting, butchering, or preparing the meat of these animals for consumption. Once a person is infected, they can then spread the virus to other people. This human-to-human transmission is what often leads to outbreaks, especially in healthcare settings where the virus can spread rapidly if proper precautions are not taken. He emphasized that Marburg spreads through direct contact with bodily fluids, such as blood, saliva, or vomit, of an infected person. This means that caregivers, family members, and healthcare workers are at high risk if they do not use protective measures, like blood, saliva, or vomit of an infected person. It's crucial to use personal protective equipment such as gloves and masks, and to follow strict hygiene protocols to prevent the spread of the virus. Public health education and awareness are key to controlling outbreaks and protecting communities from this deadly disease. Now let's talk about the symptoms you mentioned. He explained that the symptoms of Marburg disease typically appear suddenly, often within 2 to 21 days after exposure to the virus. As you described, jaw, fever, chills, headache, and muscle aches are common initial symptoms. These can progress to more severe symptoms like nausea, vomiting, diarrhea, and abdominal pain. Dr. Jones pointed out that in severe cases, Marburg can also cause bleeding, organ failure, and even death. But it's crucial to remember that not everyone infected will experience severe illness. One of the reasons Marburg is so serious is because it can lead to complications if not treated promptly. The virus can affect multiple organ systems. It can lead to severe dehydration, kidney failure, and liver damage. Dr. Jones also mentioned that Marburg can affect the central nervous system, potentially causing confusion, seizures, and coma. In some cases, Marburg can also lead to long-term health issues even after recovery. Now, John, while Marburg is serious, I want to emphasize that there are effective treatments available. He explained that while there's no specific antiviral medication for Marburg, supportive care is crucial in managing the symptoms and preventing complications. This includes things like maintaining hydration, balancing electrolytes, providing oxygen therapy, and managing any bleeding, Dr. Jones said. Early supportive care greatly improves the chances of survival. He also mentioned that researchers are actively working on developing vaccines and antiviral drugs, specifically for Marburg. Based on your symptoms and recent travel history, John, it's understandable why you're concerned about Marburg, Dr. Jones acknowledged. The Marburg virus, a rare but severe hemorrhagic fever, can indeed be alarming, especially given its high mortality rate and the recent outbreak in the region you visited. However, it's important to remember that other illnesses can cause similar symptoms. Dr. Jones emphasized that conditions such as malaria, typhoid fever, and even severe cases of influenza can present with similar initial symptoms like fever, headache, and muscle pain. He explained that to confirm a diagnosis of Marburg, specific laboratory tests are necessary. These tests are designed to detect the presence of the virus in the blood, and they are crucial because early symptoms of Marburg can be indistinguishable from other tropical diseases. These tests are usually conducted in specialized laboratories. Dr. Jones mentioned that these labs have the necessary biosafety measures to handle such dangerous pathogens safely. The process involves using techniques like polymerase chain reaction, PCR, to amplify viral genetic material, making it easier to detect.
We'll need to collect a blood sample, John, and send it for testing, Dr. Jones said. This will help us determine if your symptoms are indeed due to Marburg virus or another cause. He explained that the blood sample would be carefully handled and transported to a specialized lab equipped to perform the necessary tests.
He reassured John that the results would be available quickly, and they would discuss the next steps based on the findings. Dr. Jones also mentioned that while waiting for the results, it would be important to monitor symptoms closely and take precautions to avoid spreading any potential infection. He emphasized the importance of staying hydrated, resting, and avoiding contact with others as much as possible until a definitive diagnosis was made. This would help protect both John and those around him from any potential risk.
While we wait for the test results, John, let's talk about how to prevent the spread of Marburg, Dr. Jones suggested. He stressed the importance of avoiding contact with fruit bats, especially in areas where Marburg is known to occur.
If you must handle animals in these areas, wear appropriate protective gear, he emphasized. Dr. Jones also highlighted the importance of practicing good hygiene, such as frequent hand washing, and avoiding contact with bodily fluids of sick individuals.
These simple measures can go a long way in preventing the spread of Marburg and other infectious diseases, he said.
John, I understand that this is a lot to take in, Dr. Jones said, his voice filled with compassion. It's natural to feel anxious when facing a potential health threat. He reassured John that they would work through this together, step by step. We'll get the test results soon, and in the meantime we can discuss ways to manage your symptoms and keep you comfortable, Dr. Jones said.
He reminded John that early detection and supportive care greatly improve outcomes for Marburg disease.
Remember, John, knowledge is power, Dr. Jones said, offering a reassuring smile. By understanding Marburg and taking appropriate precautions, we can minimize its impact. He emphasized the importance of staying informed but avoiding unnecessary panic. "We'll get through this together, John," Dr. Jones said, his voice firm yet compassionate. "And remember, your health and well-being are my top priorities." With that, Dr. Jones gently squeezed John's shoulder, a small gesture that conveyed a world of reassurance and support.